And welcome back. A 47-year-old patient has been admitted to the Livingstone Hospital in Gqeberha and is in isolation after presenting symptoms of cholera. The Eastern Cape Health Authorities say that they are on high alert as they await the toxigenicity results from the National Institute for Communicable Diseases. For more on this story, let's now speak to Eastern Cape Health Department spokesperson Sizwe Kupelo. Sizwe, good morning. Thank you so much for making time for us. So why is it that the department is suspecting that this could be a cholera case?
Well, the patient that is being treated has presented with symptoms associated with cholera. This is why we are now taking precautionary measures to raise awareness and educate communities. But we must emphasize that at this stage, there are no indications that we may have outbreak. The municipality from Nelson Mandela Bay also conducted tests. They took water samples from their waste water plants, which have since come back negative as well.
Yeah. And speak to us about the toxigenicity results that you are expecting. When do you expect to receive those?
That is a protocol that's being followed by the hospital, as the patient was received on the 2nd of December, and immediately stools and other clinical tests were conducted, and we just awaiting the final results from NICT, but we did not want to wait on that. This is why we had to activate our outbreak response teams as well as health promotion, just to conduct health awareness and also embark on contact tracing in as far as this particular patient is concerned.
Yeah.
But it is clear that we are dealing with an isolated case at this stage.
Yeah, and speaking about the contact tracing, as far as you're concerned right now, it is only this patient that has presented with these symptoms. Nobody related or close to him or them have presented some symptoms as well?
Not at all. The patient had a history of having attended a funeral in the area, but the patient herself has been staying with a minor who has since been moved to relatives, and the protocols relating to contact tracing have been followed, and at this stage we can safely say there is no alarm at all. We're just taking precautionary measures to educate people.
Okay, so the awareness campaign has been activated. What happens if the results come back positive? What's the plan of action?
Yes, we are working with our colleagues from the municipality, the environmental health services, health promotions from the department, as well as the outbreak response team that is specifically trained in epidemiology, just to go into communities and ensure that we keep people informed and also educate them about the importance of good hygiene.
Yeah. Sizwe, just before we conclude the conversation, when we had a high concentration of cholera cases in the middle of this year, around about May, June as well, how was the Eastern Cape impacted by that? Were there any cases that came from the Eastern Cape?
No, not at all. We last had incidents of cholera in the Eastern Cape in the early 2000s, around 2002 and 2003, and we successfully eliminated the problem here because we worked with municipalities and improved sanitation, particularly in rural areas. But as the Eastern Cape being a labor-sending area, this is a very critical period for us because we expect people to come back, to come to the province for holidays. We normally get imported cases, especially those related to waterborne diseases. So it's always important for us as a province to be on alert, especially around this time.
Yeah. Your advice to residents of the Eastern Cape right now?
My advice is that for now there is no alarm, but it's always good for people to practice good hygiene. Hygiene is very important. Washing of hands, especially before you take food or coming from the toilet. So we need to emphasize on that. Washing hands with safe water and also washing hands with soap.
Thank you so much for your time. That is the spokesperson for the Eastern Cape Health Department, Sizwe Kupelo, on a suspected case of cholera, but they're still waiting for the results to come back.